Hello, can you hear me?
Hello and welcome to a special episode of Can You Hear Me? With panellists from the West Yorkshire and Harrogate Health and Care Partnership's independent review into the impact of COVID-19 on health inequalities and the support needed for Black, Asian and minority ethnic communities and staff. The conversation was hosted by Rob Webster, lead CEO for our partnership, who was joined by Professor Dame Donna Kinnair, the Chief Executive and General Secretary of the Royal College of Nursing and the Chair of our review, and by review panellists from health and care organisations, councils and community and voluntary sector organisations across West Yorkshire and Harrogate. Let's hear what they had to say.
I'm joined by a number of people here today. We're going to discuss some reflections on the review and what it meant to them. The first question really is about why people got involved in the first place. And I think I'll start with Professor Dame Donna, who we were delighted got involved in the review with us. So Professor Dame Donna, why did you agree to be part of the review panel?
I think it's because as a health visitor and as a nurse, it really took me back to the roots of some of the work I did earlier in my nursing. And it is hugely important because I know from a lot of work I've done in communities or with communities is that good work, good health can only be achieved by engaging with communities and understanding their needs. And in fact, giving them or empowering them to help improve their own health. So it was really, really important in view of the things that I'd seen with COVID, my whole belief system about the way in which people can take control of their own health with some support from the system. But also, you know, what we do know is COVID has shone a light on some of the disparities in our system. And actually, it's only us that can fix it.
Yeah, and certainly an opportunity for us to fix it. Alison Law, Professor Dame Donna there talked about, you know, listening to and engaging with our communities, and you're embedded within communities in the work that you do. Why did you get involved in the review?
It's because as a woman of colour, as a woman with black children, black gay children, I understand from a very personal perspective the impacts of racism and structural racism to people's ability to live the lives that they're supposed to live, healthy lives, without barriers, without injustice. And for me, I was passionate about being part of the solution. I also wanted to be part of influencing the discussion and the conversations. I take pride in the fact that I do speak truth to power, and I wanted to be able to say to those people across the ICS community that the hard conversations had been had, and that I was confident that having had those conversations, the outcomes were going to be better services for the people that we represent, we serve, but also that we are part of.
Yeah, and you know, I think having worked with you before, Alison, I think your ability to speak truth authentically to power means you've brought a huge amount to this process. And I think you mentioned somebody else who's got, you know, very, very influential and persuasive, Fatima. How did you and why did you get involved in the review?
I joined the review for a few reasons. I think the first is, you know, as a Pakistani Muslim woman, as a parent, COVID has impacted me significantly. You know, I've lost loved ones to it. It's impacted my friends, my family, my loved ones, and I am very much somebody who is very fortunate to be in an influencing position. People hear what I've got to say. I'm able to change things for the better, and I felt really helpless during the first period of COVID. I saw lots of things happening that I couldn't control. I saw people distress, and I saw a magnification of issues in society that I was aware of before, and sort of tried to do something about it, but kind of left it, and it created this real feeling of regret, and I felt like I needed to do something. And when you asked me to get involved, I really felt that this was going to be different to the usual review. So, you know, we've been in many processes where we have conversations that seem really impactful and are going to change things, and they don't seem to lead to anything. I genuinely have experienced in this partnership that we don't roll like that. We are very much, if we say we're going to do something, it's going to get done. And one of the amazing things about the BAME network, particularly, which is one of the reasons why I'm on the review panel, is the opportunity to amplify their lived experience. And we saw that with Kez's testimony in meeting 3, and the real bringing to life of his lived experience of not only working as a staff member, you know, in an acute hospital in one of the most diverse parts of our region, but also how it impacted him personally. And I think all those reasons really motivated me to be part of this review. But also, I think it's one of the most exciting and trend-setting things we've ever done in this partnership. And I think when we see the outcomes of it, I think it's going to be very exciting to see what happens next.
I think that's right. I think we should be optimistic about the opportunity that we've got, and what we need to do is to take it. Sahil, have you been involved in speaking to people more widely about the review, and what do you think their attitude's been towards the work?
What I have observed, an extreme passion and real desire to do something practical for the BAME communities. And I think, I mean, health inequalities have always been here. It's been, and the COVID-19 essentially hasn't created health inequalities. It just exacerbated those inequalities. And I think it's the good thing is that everyone is now talking about it. And I mean, yesterday we were in clinical forum, and there was a discussion around the answer or the response from our ICS to NHS England and to the regulators about that in access and in restart and recovery, how our ICS will make sure that we will not adversely impact on our Black and minority ethnic communities. And I think that is really brave, and really, you know, that tells us that we are really serious in doing something, and it's not just talking. So I would say it's a start. It's a good start. This review, it's it gives us, you know, the depth of the stuff we are doing around the ICS. But I think the next step will really be taking one or two things and make a real difference. So yeah. I see it as a start of a journey.
So we're already seeing different conversations happening in different fora because of the work, which is good to hear.
You're listening to Can You Hear Me? The West Yorkshire and Harrogate Health and Care Partnership BAME Network podcast.
Simon, you've been working with us a bit on things like CCG assurance sessions and talking to the system. What's your experience been of people's attitudes towards this review?
Thanks, Rob. Yeah, do you know what I'd say is I'm just really privileged to be on this journey, because the attitudes that I've seen from people wanting to do this work, I've not seen elsewhere. A lot of the time we do hear that people want to make a difference, but then nothing comes from that. And what I've experienced with attitudes from people that I've come across in our partnership is that there's a true commitment to really making a difference and seeing it through. And that's been really encouraging, because for me, I want to be part of that solution. I am also from a Pakistani background, Muslim, so I get that picture. There's not enough of us in decision-making forums. So when we get that platform, we've got to use that. We've got to recognise that we've got that power to make that difference. And the attitudes that I've seen from gosh, the whole partnership that I've come across has just been so encouraging that how can we not use this platform now to really follow through on those commitments? So yeah, excited.
That's great. So have any of us come across people who don't really see it as important, or you think are paying lip service to the work?
Well, as someone who's chairing the BCS panel, it's fair to say that at our first meeting, there were lots and lots of scepticism about the outcome of this review. We've heard it before, we've been asked many times before, and I think that I'm taking them on this journey with me, and people are beginning to move. And obviously, we've agreed that we're going to have a meeting with Dame Professor Donna to understand her motivation and what she hopes is going to come out of all this. But I think that the issue is, how do we engage those communities that we serve and get them to understand that this time it's different? I think the lens of Black Lives Matter is a brilliant opportunity to start those conversations again with people in a different way, so that they do have more faith that things are changing. But it's definitely a barrier to people believing that things can be different, because we've been told it can be different so many times and it has not been.
Yeah, we must recognise that, mustn't we? I think one of the things that attracted us to Professor Dame Donna working with us was her forthright views, I think, on question time about some of these issues. And as a fairly simple person working in the health and care system, I think my experience has been, if we're committed to sorting something out, we tend to get on with it and do it. And clearly we haven't made a difference in this area, so we can't have been as serious as we should have been. And we know it goes beyond the health and care system and into wider society, but we are serious players and leaders within the system, and we work, in the most trusted professions. So there must be something we can do about this, but we've got to recognise that there'll be scepticism and that there'll be people who have other priorities or think they're doing enough on this. Now, I think that one of the real benefits we've had is that people like Maddie and Sarah have provided us with lots of data and evidence, because I think we can persuade people through our passion and our commitment and our desire, but some people we have to persuade with the evidence. And I think we've had lots of positive support from Maddie and Sarah on that front. How optimistic do you think, given the evidence, Maddie or Sarah, that we can start to measure some improvements?
I'm generally an optimistic person, but I do feel really optimistic this time because of the commitment we've made, because of the kind of cross-sector leadership we've got on the review panel, and because of the kind of the detail we've gone into and the things we've brought to light, including the evidence, but also the really powerful stories we've heard. I feel kind of really optimistic this time we're able to make a difference. And I think it helps that that's coupled with some national direction that's sort of enabling us to drive it forward. And I think we can use that sort of to push it further in West Yorkshire and Harrogate. And I feel like we've got some of the mechanisms to take it forward as well. Now we've just got to the point, the Health Inequalities Network that Sahel chairs, working in partnership with the BAME network that Fatima chairs. So us working between programmes there, I think we've got the desire to take it forward and the mechanisms to take it forward as well. And we're beginning to get that commitment from wider partners and not the usual health inequality suspects within the partnership as well. So I think now is the time really we can act on this, and we've picked a really good time to do this review and take this work forward.
So it's pleasing to hear that this isn't just an echo chamber where we're all, patting each other on the back and, talking about our experiences, but there's people being reached beyond the usual suspects. Maddie?
We've looked at the data a bit differently while we've been doing this, and we've been looking at the data, specifically thinking about how can we use this in combination with story to make it that there's something we're actually going to do. So instead of a report that says we recommend all of these 100,000 things, we've been really careful about looking at what does the data we've got say, but what does that mean in terms of the groups, the networks, the infrastructure that we have in place across West Yorkshire and Harrogate, that means we're actually going to be able to use that information to make a difference. So we've been tying the bits of insight together with groups that are actually going to be responsible and accountable for making a difference. And for me, that's what makes it feel different. It's not just a report full of these are all the big umbrella things we should be doing, but we've been really careful about targeting the information and the recommendations into things that we as West Yorkshire and Harrogate are actually going to, not just words on a page.
That's great. And, I think the true measure of whether we're successful is people in communities feeling it.
You're listening to Can You Hear Me? A podcast from the West Yorkshire and Harrogate Health and Care Partnership BAME Network.
What's really struck me is the level of ambition, the unified ambition that I'm seeing amongst the whole of the community. I think that sometimes you're ambitious and you can be over ambitious, but what's beautiful about this is it's grounded in community. I won't say that I haven't been cynical as I've chaired this at some of the comments I've heard, because actually, sort of after 35 years of living and breathing health and care, you will hear some of those things. But for me, it's the coming together to think, actually, well, we know that that's just an element of speech. We really want to do something, and it's the ambition with the community input that has really made this come alive, basing it on community stories, community lived experience, and then trying to move forward with some meaningful answers. And I think that there isn't a homogenous BAME community. We're all here with different lived experiences, different reasons, and even if we collect all the information, there's no homogeneity in the BAME community, but we have to develop nuances to the care that we provide so that it's truly person-centred and place-centred. So that, for me, has been one of the special things about chairing this group.
Fantastic. Cyber.
Thanks, Rob. Yeah, I just echo what everyone's just said there. And I think that bit about it feeling different, it has felt different from, I think, within the partnership. And I think where we're at is being able to share that with the population, that this time it is different. And I think the reason it feels different is the mature relationships between the partners in that partnership. And it's new to me, but it's really obvious that everyone's seen as an equal partner in that partnership. So that journey that I think we, as members of the partnership have been on, it's important for us to now share that journey, because that bit about following through, we've got to follow through because it has to be different, and we've all said it feels different. So if it feels different, we need to use that energy and follow that through to make sure our population see that it's different. And I think through this inquiry, what we've done is we've talked about the why and we've talked about the what, and we're at that point of how now. How are we going to then do this differently?
So just tell me a bit more about what you mean for people listening in terms of equal partners. Are you talking about yourself? Are you talking about organisations? Are you talking about places? What do you mean by equal partners?
I think it just mean everyone. So when we talk often, me being from an NHS background, I often will come at it from an NHS background. But when we're doing this work through the inquiry and the partnership, other work that we do, it's equal partners from local authority, voluntary care sector, just a place base. It's just everything really, because until you include everyone in that partnership, you're not truly going to meet the needs and meet in the middle.
So with one of the things that I think Maddie talked about earlier was keeping things focused, and we want this to be a short, focused podcast. And so I'm going to ask you all for a short reflection, and what is your takeaway message for the partnership and for people listening to this podcast? And so Sahil, why don't you go first?
So I think, as everyone said, that it feels different. we need to continue this work. And I think we need to work on changing the perception of our BAME communities, because that is the main thing. And that can only happen if we are going to show that we care practically, and also we tell our people that we care and they are equal partners. And I think all these messages needs to go out from us and everyone, from these walled rooms to outside in the community. Because if you look at the perception of people, and again yesterday we were talking in clinical forum about end of life care. And for example, within COVID-19, there has been so different messages and perceptions of our communities. Some communities have taken advanced care planning as euthanasia and active killing. Some communities have been very engaged, and we have to go down, deep down, what is the actual reason? And that goes to real social inequalities and lived experiences of people, because there is skepticism. Yeah. As Fatima said, and if we can change that perception, I think that is the journey we need to take.
So I really like that, Sahil, and changing people's perceptions, because we change their reality. Yeah. We can only do that by having difficult conversations, I think. Sarah, why don't you go next?
I'll keep it short and sweet, really. I think for me, the take-home message is that this review shows as a partnership we're committed to reducing health inequalities, and gives us the opportunity to kind of really demonstrate that in a practical way, and show that nationally we're kind of beacons and leaders on this, and I'm really proud of that as well. So that's my take-home message.
You're listening to Can You Hear Me, the West Yorkshire and Harrogate Health and Care Partnership BAME Network podcast.
The message for me is that the world is not a fair place, and we want West Yorkshire and Harrogate to be fairer than it's ever been before by really doing things differently following this review. I think that it's important that we recognise the impact of white privilege on the experiences of Black, Asian, minority ethnic people in our communities, and those people with positions of power need to understand that power needs to be used positively to make those changes, and that they need to work in partnership as allies with those people who have been worst affected by health inequalities for centuries. So be our partners, be our allies, work with us to make the reality different going forward.
Fantastic. Thank you, Alison. Maddie?
For me, I guess the strongest thing that's come out of this really follows on from Alison. The strongest message that comes out of this is what I've learned from it. I really had never contemplated racism in the way that going through this review has allowed me to just start thinking about understanding my white privilege, my white fragility, what the term of a saviour might be. All of these really uncomfortable things has been a real takeaway message, and just the first step on it, just the first step of eye-opening kind of awareness of how little I know. And so my takeaway message is for everyone to pull at that thread, and it's uncomfortable and emotional and painful. So understanding what that may be like in some tiny way has been hugely powerful, and I would recommend everyone try and take a step on this journey too.
Fatima?
So my take-home message would be that this has been a really ambitious and fast-paced experience, which is, I think, pushed us all really hard. But I'm really, really proud of the fact that we were encouraged to think outside the box. In fact, we were pushed to think transformationally about the solutions, which I think makes us really different to a lot of the national stuff that I've been involved in. And I think, one of the reasons why I'm proud to live and work in West Yorkshire and Harrogate is how we roll we do think differently, and we're not scared to do things in a way that's a bit unorthodox if it's the right thing to do. And I'm really proud of what we've achieved, whatever the outcome next is.
Great stuff. Simon?
Thanks, Rob. Yeah, I think my takeaway message would be we've not come this far to only come this far. We've done all this hard work. We've all had those late nights where we're trying to meet deadlines, but we've done so much that we're at that point now where we're absolutely leading the way nationally. So we've got to keep pushing. We've got to be humble leaders. We've got to listen to those uncomfortable truths. We've got to hold that mirror up. And each of us has privilege, whether you're BAME or whether you're not BAME. We all have privilege at some points of our lives. And when you start to recognise that and turn that into helping others, I think that's the way to get through. So, as I say, we haven't come this far to only come this far.
Fantastic. Karen, do you want to add anything?
Thank you. I think it's very easy, I guess, to look at somebody like myself, with blonde hair, very white, obviously very white. And I don't know what it feels like to be BAME, but I do know what it feels like to have mixed race grandchildren. And I know that I'm absolutely overwhelmed and bowled over to know that I've got BAME colleagues and friends and leaders, everybody really across the partnership, which makes me very proud to know that you're looking out for my grandkids. So thank you for that.
Professor Dame Donna, last word for you then. So it's take-home messages for people listening and for the partnership.
I think for me, the takeaway message that I'm going to be thinking is go look at West Yorkshire and Harrogate region, because people have come together. We haven't achieved everything yet, but the very fact that you've put yourselves out there and you're really looking at tangible impacts on your community, tangible things that you can deliver. And the whole scale of the ambition has been heartwarming for me. I'm usually there speaking truth to power, and that I'd be telling you if you weren't doing that. But it's been a real privilege to sort of sit with you, walk this journey with you. It's just been a real privilege to see the scale of ambition, the tangible impacts that you want to have and are having actually to a degree already, and how you want to develop some of those things so that every single member of your community benefits, whoever they are. So, if you're doing something for the least privileged, you're doing it for the most as well. So I think it's been a truly privileged walk with you.
Yeah. So I think this podcast and the conversations have really underlined people's commitment to this agenda, and also the fact that we've all learned things during the process. And one of the things that I would really want to reinforce in all of this is that our partnership serves the partners. And what we're trying to do is to recognise that the partners themselves are here for the public, and to address inequalities, manage unwarranted variations in care, and to make sure that we use our resources to make the biggest difference that we can. And I think Alison talked about power. And I worked with somebody once who told me something which I think is really true. People look at power and they think it's finite. If you give it away, you're losing something. But actually, power is like love. If you give it away, it gets bigger. There isn't finite. What you're doing is you're increasing power because you're giving people the opportunity to demonstrate their power. And what's really been clear to me in this review is how brilliant all of the people involved have been, how much they've brought. And by giving people the power and the authority to speak, to help create something, what we'll do is potentially make the biggest difference that we can.
Can you hear me now? Thank you to Dame Professor Donna Kinnair, Rob Webster, and all the panellists from the West Yorkshire and Harrogate Health and Care Partnership's independent review into the impact of COVID-19 on health inequalities and the support needed for Black, Asian and minority ethnic communities and staff. Thanks for listening.